Welcome, everybody, to the audio edition of Mind, Body, Soul. I'm Gary Summers, and my special guest today is Susan Goodman. And Susan has a very special and unique story. Susan has a very unique and special story to tell us. So, welcome, Susan Goodman.
Thank you.
So Susan, to start off with, and I know we had chats before, and your story is so incredibly positive and uplifting, and as well as it's got its dark side as well. But obviously, you came through this on the right side. So, I guess the first question, let's dig deep into this. So, because you've gone from the lowest that you could go to where you are now, and God bless you and God love you for that. So just tell us why you believe the healthcare system needs to be more proactive with regards to holistic healing.
Well, Gary, to tell you the truth, my story, I believe, is a tragedy that didn't have to happen. I was in recovery myself, and I had gone through a traumatic breakup. My marriage had broken down, and I was prescribed medication for depression. And I was already following a holistic path. I was already practicing yoga, and I was already doing meditation, and I was already exploring energy healing. When I have to take responsibility, of course. I did take the medication, and I went from being a single mom and a business owner who was on track to a wellness path to being trapped in a cycle of addiction and a street life, and in and out of mental health, the mental hospital, they call it here in St. John's, in and out of psychiatric wards. It was really unnecessary, and I recognize that now, that there was another way, but it wasn't available to me at the time. And I believe that that other path is available here, and we have a unique opportunity in St. John's with the new Waterford Hospital coming to actually embrace some of the holistic therapies that are there before we send a whole other generation down the same path.
So the normal way, and I'm not saying there's anything wrong with it. I'm just saying that the normal way that this works is you come in with an addiction and they throw pills at you.
Yes, absolutely. Unfortunately, it still works that way. It's worked that way for a very long time. Anybody who does any studies into drug replacement therapy, using drugs to replace drugs, would be able to, the background on it, some of the background on it is morphine was a drug replacement for heroin. So I'm not saying that there isn't a place for medication. There certainly is, and there's certainly a place for medication in mental health as well. But we need to look at the fact that when people have a chemical imbalance and trying to balance that with chemicals before giving them the opportunity, and there are some people I recognize, and I do recognize some people aren't going to be able to do this, but the option should be there. I didn't have the option to use holistic therapies. I was trapped by the fact that the medication therapies that were offered to me were not only free, they were covered by the government. They were covered by medical plans and all of this. So it was much easier. Somebody who's already in that cycle and in that poverty sector and doesn't have health insurance that covers perhaps a holistic energy healing or something, doesn't even have the option. And the options weren't available in the hospitals either.
So Susan, just you say you were being trapped in a cycle of addiction by the people who were meant to help you. Can you just explain that a little bit more?
Yeah, again, my story, like I said, my story is one that didn't have to happen. I self-identified as an addict. So I went to, because of my, I have the disease of alcoholism, because of that, I went to the doctors, and when I went to my doctors, when I went to dentists, I would self-identify and I would say, you can't give me these things. And it would always be, well, I had a back injury. And with my back injury, I had told the doctor I had troubles with addiction and I couldn't take anything. And I needed to have pain management. And for 2 years, he tried other modalities. They just weren't available to me. Pain management wasn't available. There wasn't yoga available or physiotherapy. It just wasn't made available to me, and it wasn't encouraged. And finally, he said, we're going to have to give you medication for the pain, to manage the pain in your back. There isn't anything that we can do with getting you into pain management. There isn't anything there for you. You don't have insurance to cover it. And I was already trapped in this place where the medication would be covered and I would get relief from pain. Unfortunately, I was an addict and I wasn't in any place. By this time, I was already on medications for mental health issues, because coming off, and we know this now, we didn't know it then, and I do recognize that. That's what's important, is that we do know that withdrawal from drugs or alcohol can take a couple of years, and it can manifest to look like mental illness. When we look at post-acute withdrawal syndrome, it mimics bipolar disorder. The highs and the lows of addiction recovery mimic some of the mental illnesses that are being diagnosed and treated with drugs, and they're being treated with addictive drugs. So it makes it almost impossible for someone in addiction who doesn't have that ability to say, I need to feel the pain in order to get through it, and I need the support for that. And that wasn't there for me. I didn't have that. I'm very blessed to have the same psychiatrist who took me through the mental illness, also taking me through this journey and recognizing that medication wasn't the answer.
Were you
that there's another answer.
were you suicidal? Were you suicidal taking your antidepressants?
Unfortunately, it was one of the things that wasn't explored the first time I was prescribed antidepressants, that I had had incidents as a teenager and as a very young mother, which I would recognize were probably postpartum stuff. I had 2 suicide attempts, and I was prescribed an antidepressant that has one of its side effects, and this is unfortunate, but depression can bring us to a place where we actually want to leave this earth. And unfortunately, many of the antidepressants also cause suicidal ideation. So I was prescribed an antidepressant by a family doctor who didn't have the background to prescribe psychiatric medications and who didn't do the exploration, and I became suicidal again on that antidepressant as well. So yeah, part of my story, and I'm actually chronicling it in a book, which I entitled Empowered Awareness, Surviving Suicide. Part of my story is that coming off all of these drugs, after getting clean off of all substances, coming off all of these medications actually put me into another place where I became incredibly suicidal. And
no, go ahead.
For a number of years coming off the drugs, I lived almost in a psychosis where I was suicidal, and at the same time aware that it wasn't me, that I had no desire to die, yet I still had this stuff coming up that was being released that was a part of the medications and the way my brain needed to chemically rebalance itself.
But I guess that's the way it's always was done in the past. So I guess they just followed the same one size fits all kind of syndrome. So Susan, how did you become to get involved with the mental health care system?
As I said, I was prescribed an antidepressant for my marriage broke down, and again, I don't blame anyone there. It was one of those things where things didn't work out. We went our separate ways. I was a single mom. I was in recovery for alcoholism. And I was in the midst of trying to continue a business that I had just started the year before when my marriage broke down. So I went through a huge trauma. And I went to my doctor and I was prescribed an antidepressant for what he labeled as clinical depression. Unfortunately, the antidepressant made me suicidal, and I went to a psychiatric, to the St. Clair's Hospital emergency, and a psychiatrist then took a look at the medication, and he said, okay, well, I'm going to double the medication and see you in 3 weeks. And his reason for doubling the medication was because he believed the medication was causing my problems. But he wanted to be sure. So he increased it. It made things worse. And when I saw him in 3 weeks, he said, I knew it would. And through a series of questions, no blood tests, nothing like that, through a series of questions, he diagnosed me as bipolar. But he didn't have any understanding for alcoholism. And as I said, they didn't understand post-acute withdrawal syndrome like they do now. So he didn't have any understanding for what I was tackling in my recovery from alcoholism. He didn't understand the highs and lows. He now works with me on that aspect and takes a great deal more interest in understanding that. So he couldn't possibly know that what he was treating was my withdrawal from alcoholism, the long-term withdrawal effects, the cycle of ups and downs, with now more medication, mood stabilizers, things that completely shut down my brain.
So did the medication help you or hurt you with your recovery from alcoholism?
Unfortunately, it made it worse. Because the medication shut down my ability to think, I became numbed out. It also shut down my anxiety. So eventually, I didn't really feel when I was doing something wrong. I couldn't make decisions, and I take responsibility for anything that I did. But when you're taking enough medication that you don't feel anything, then that sense of fear that comes with stepping into a risky situation or making a decision that's going to come with negative consequences went away. And I got into a high-risk relationship that was extremely toxic, and I was traumatized all over again. So I wound up with a partner who was on drugs and who started to put the drugs into my tea. And I wound up on drugs with that partner. Again, I take responsibility for taking the drugs, but had I not been on medications that were shutting down my decision-making process, and had I been working a stronger recovery program that wasn't being shut down and able to feel what it was that I was going through and challenge, and I do that today and I help others to do it as well, challenge those traumatic memories and challenge them and learn from them. I use the law of attraction to practice, but I use the law of responsibility first. We created the reality that we live. And I take responsibility for everything that I've done and for having created this. I created this situation where I said, yes, I'm going to take medication. There was a time when I was 18 years old, and again, alcohol doesn't work on my brain like it does other people's. And so I had a breakdown there. I said, no, I'm definitely not going to take medication. That's not the answer. And I went with journaling and with holistic remedies then, and I was always seeking holistic remedies, and I got lazy, and I said, all right, this is hard, and I'm going to take something, and I'm going to believe that my brain is chemically imbalanced. It is. It doesn't process alcohol and drugs the same as other people's.
So what okay, what
they
would
can't
you
possibly
say?
know what to give me.
Sure.
Right.
What would you say to someone who said, would you be blaming the medication? They gave me the wrong medication. That's why I failed in my drug recovery. What would you say to someone who said, aren't you just blaming the medication on this when you really weren't ready to begin with?
Absolutely. To them, do I say that I'm blaming the medication? No, I'm saying that the medication shuts down our ability to think straight. It shuts down our ability to feel our emotions. And really, it's a choice. Medication is a choice. If I'm not ready to feel that stuff, I can take medication. I can't take it responsibly. I don't take it responsibly. If I've got it in my body, an alcoholic can't put alcohol in their body because it sets off a whole process.
Sure.
And that's the same for others that are chemically imbalanced. Do I blame the medication? Of course not. I take responsibility for having taken the medication in the first place. What I believe is that everybody should have the opportunity to do this without medication.
So Susan, here you mentioned angels, and your business is angelic energy. Can you tell us more about your connection with angels? Because this is really the core of what turned your life around, isn't it? And
It
you
is
know,
absolutely.
and whatever you can use, whatever holistic method you can use, whether it's your method or whether it's somebody else's method, to find that part, that source that allows you to get back to living your life the way it was meant to be led. So talk to us about that, your angelic healing, and how that all came about.
Absolutely the core of this is I was totally unaware. I did not know I was as sick as I was. I had no idea that even the life that I was living was a complete life of unawareness. And I had what would be determined by the medical profession as a complete psychotic break. I started to hear voices, and I could hear the voices, and I'd never heard voices. In all of the diagnoses that they'd given me, psychosis was never one of them. And I was blessed in the sense that my regular psychiatrist was on a 6-month sabbatical. So I didn't have him to continue to prescribe the medications. I was thrown into a whole new situation. But the voices that I heard were giving me direction. And they were talking about stuff that I had let go years before. They were talking about rebalancing my chakras. And one of them told me to do something, and now do the same thing, only different. Another told me to say my rosary. And I found myself again following this path and starting to communicate with these voices. And the more I started to communicate with what I was hearing, the stronger the connection became. And the more I started to do that, the more I started to connect with these angelic beings, these light beings, who brought into my life more direction. And people like yourself, these connections were put into place. I began to study with Melanie Beckler, who is a channel. She channels the angels. And I began to study with her. And I studied angel energy healing myself. I stopped watching television for a long time. I changed all of the books that I read. I changed not only the books that I read, but I started listening to audio meditations. And I began to reprogram my brain and to receive downloads from these angelic guides. And I know that the miracles that I received were through these energy healings, through these divine downloads. That connection has been huge in my recovery. I didn't just, the path from being in recovery from alcoholism to winding up as sick as I was with a back injury, then included irritable bowel syndrome, chronic lung infections, chronic sinus infections, obesity. All of those things over the last few years also got healed. But the first thing that got healed was my back. I was in so much pain that I had to sit down to peel potatoes. And I lay in a hospital bed in the psychiatric ward praying, make me teachable, send me a teacher, make me teachable, send me a teacher. Talking to these guides, these angelic guides, and trying to ignore the darker voices that were there as well. And my back pain disappeared. It was completely taken away. And I believe that was the thing that allowed me to start on the next part of my path, because I could give up the pain medication.
So
That was the first miracle I was given.
Yeah. So before we finish up, because I want you to leave our listeners with a final thought, I think what you're basically saying, and whether you call them angels, whether you call them inner talk, whether you call them spiritual, whether you call them guides, I think the most important thing, and you talked about the law of attraction, I think the most important thing for people to understand is if you look for something, you will find it. And that can be either sickness or it can be health. And if you continue to go down the path of blaming other people, complaining about life, complaining about what life has thrown you, life will only throw you more of that. But when you say, send me something, I need something to help me on this journey, there's something, I've got more to give, then the world will open up to everybody. I'm not a special person. I don't have any special skills. You're not we're the same. Everybody in this universe their brain works exactly the same. So if people could only listen to your story, because if one person can do it, everybody can do it.
Absolutely. I would say you are a special person. You have special skills. And every one of us is special. We all have divine gifts and we all have the ability to tap into them. I'm not special and I'm not different. I'm
Exactly.
just tapped in to a higher source, the same higher source that created this universe and the same higher source that's more than happy. We were given free will. And that divine energy is happy to give us whatever we want. And it gives us what we focus on. So if I focus on recovery and empowerment and healing, I will get recovery and empowerment and healing. And if I focus on a quick fix, I'll be given a quick fix.
And
I don't judge anyone for what choice they make. I just advocate for free will choices for everybody. So no matter where you're at, there should be the opportunity to access these choices.
And when you talked about focus, and before I ask you to leave everybody with something special that they can take away today, I think the thing when you talk about focus is, the thing with focus is whatever you focus on gets bigger. So when you're focusing on what's wrong with you, then you wonder why it keeps showing up every day in your life. That's why you're focusing on it. But if you focus on, okay, what can I do different? What do I need to do now to make my life better? How can I do some things instead of asking the question, why? Why me? Why did this have to happen to me? Why couldn't life be better for me? So yeah, so that we need to really start to look at what are the things, if our life is not working out the way we want it to, we need to ask ourselves, what are we focusing on? Because normally it's what we're focusing on and thinking about that's really creating the problem. Susan, if you had to leave someone, if to leave our listeners with something right now, it's probably the biggest lesson that you've learned to come through all of this. How could we end this off and leave our listeners?
Gratitude and appreciation. Start with being grateful for the things that I have. That's the first one. But really, really being grateful, saying and focusing on myself as well, being grateful. Again, it all begins with us. So if I'm grateful for the fact that my heart continued to keep beating through all this, I don't know why I didn't die when I attempted suicide. My heart chose to keep beating. So if I'm grateful for the fact that my heart's beating, it's going to get stronger. As you said, it's going to grow. Everything's going to grow. If I'm grateful for the fact that I can get out of bed this morning, and if I can't get out of bed, be grateful for the fact that I have a bed.
It is. I always say to people say, well, life is so complicated, and I say, no, life is pretty simple. It's us as humans who make it complicated. But before I let you go, when you talked about gratitude, one of the things, and this is what I'd like to leave our listeners with, if you find, even if you don't find that you're more off than you are on, do, like Susan said, do a gratitude list, do an appreciation list. And here's how you do it. You take out a sheet of paper and you make 3 columns. On the left-hand side of the column, you write down all the people in your life who you're grateful for, who you appreciate, the people who send you love, the people who you look up to. In the middle column, not that things are important, but things that you've acquired. Maybe you bought a special ring or a motorcycle or a cabin or something. So list the things that you've really worked hard to acquire. And on the right hand side, list down the things that you would never compromise for anything. You know, your integrity, your honesty, your sincerity, your good humor, whatever the thing is. And every night when you go to bed, read it. And when you get up in the morning, read it again. And any time during the day, take the list with you. And any time during the day that you feel yourself getting off track, take the list out and read it. And you'll find, as Susan said, when you are grateful for all the things that you have in your life, the things that you're ungrateful for don't matter.
Yeah.
Because you're not focusing on the things that you're ungrateful for. You're not focusing on the things that you don't have. You're focusing on the things that you do have. And that's the key to becoming the best version of yourself that you possibly can be. Susan, thank you very much.
Thank you.
We did this interview for those of you listening via Zoom. And I have to say, since the last time I spoke to you, you're even looking better than you did the last time. And I mean that in the most possible, best way that you could do it. You seem to be thriving better than you ever have.
Thank you. I am.
Considering,
I would add one thing to my gratitude list. Gratitude for the things that I don't have, because they're what gives me hope for tomorrow.
well, there you go.
Challenges that I can go for.
There you go. There you go. Susan, thank you. Thank you very much for your time. And anytime again, if you ever want to come on and your voice is we'd love to. You have a voice on this Facebook page whenever you want to come on, because I'm sure you're an inspiration to everybody.
Wonderful. Thank you very much, Gary, and thank you for having the page.
Thank you very much, Susan. I'll talk to you later.
Bye-bye.
Okay, bye.